Hospitals and fever clinics in China struggle with a surge in COVID-19 cases. There are reports of a sequencing at crematorium in Beijing, even as China records zero COVID deaths for the second consecutive day. Now, a data firm is claiming that the real scale of the infection could be far greater than what the official data is showing in China. According to the British-based healthcare data firm, infections in China are likely to be more than 1 million a day, with deaths at more than 5,000 a day. The data firm says it examined data from China's regional provinces, noting that COVID cases are rising quicker in Beijing and southern province of the country as well. The health firm's revelation is a stark contrast from China's official data. The National Health Commission of China has reported only a handful of COVID-related deaths since the reopening, taking China's official pandemic total to 5,241 deaths, which is very low by the global standards. Last week, the US-based Institute of Health Metrics and Evaluation, part of the University of Washington, said it expects more than 1 million deaths through 2023, given the low full vaccination rates among its vulnerable elderly population in the country. Now, after years of enforcing harsh measures to stamp out of the COVID-19 virus, Xi Jinping's abrupt abandonment of zero COVID in the face of protests and a widening outbreak has left China scrambling to avert a collapse of its public health system. The sudden spike in new infections in the past 2 weeks has placed enormous strain on medical resources and hospitals, even as the government has urged people to stay home unless they are very sick. People have been flocking to hospitals and clinics in panic. On Wednesday itself, the World Health Organization said that it is concerned about the spike in infections and is supporting the Chinese government to focus on vaccinating those at the highest risk. The WHO Director General said that the agency needs more detailed information on the severity of the infection. China has been routinely accused of downplaying its COVID outbreak, and reports say that its narrow criteria for identifying deaths will underestimate the true toll in the country. And for more on this, Professor Haggai Levine, who is an epidemiologist from the Hebrew University and chairman of the Israel Association of Public Health, is joining us live from Israel. Welcome to the broadcast, Professor.
Hello, Aisha.
So I want to first start by asking you that there are reports of Chinese hospitals struggling and crematoriums being overwhelmed. How serious is the situation and how prepared are the Chinese hospitals?
We really don't know. We need reliable data, epidemiological data, in order to better understand the situation. As a physician, we know that when the patient is in transition, that's the most risky time. And now China is in transition from its zero COVID policy to living with COVID. And this is very complicated for them. It seems like they were not well prepared for this transition. They could have done better job in preparing the population, preparing the hospitals for this transition. I must say I coordinated courses for public health professionals from China over the last decade before COVID. And my motto for them was be prepared, be flexible, as we teach at the Hebrew University Hadassah School of Public Health. And it seems like that now they are flexible with their policy, but I'm not sure that they were well prepared for this complex transition.
Like you mentioned, that China was not prepared to open up the country. Experts now warn that China will record more than 1 million cases a day. And clearly, these revelations stand in contrast to China's official data. Now, I want to ask you that, will China threaten the world with the virus yet again?
I think that we should avoid this kind of terminology of one country threatening the world, etc. It's one word. COVID is here everywhere, in India, in Israel, in China, everywhere there is COVID. I don't think that the situation in China is problematic. We need to see how can we help China now. You know, in the future, we may need help from other countries everywhere. So now China is in a crucial moment. We need to see how we can help the Chinese people. And I don't think we should think like, okay, it could infect us, etc. Because COVID is now everywhere, and we need in each country to see how we better protect the public health by long-term investment in public health. You know, this idea of lockdowns and, you know, in solving the issue by zero policy is not sustainable. And I think that China now realize that, and other countries realize that before, but to the public and to the public in China, living with COVID does not mean not doing anything. We still need cautious behavior. We still need to strengthen the public health system. And that's what Chinese people should do. And that's what we should do in other countries. You know, we shouldn't say, okay, COVID is over and we can forget about it. No, we could have other waves of COVID regardless of China.
Right. How concerned we should be in the wake of the spread of the BF.7 variant at this moment?
We speak about the epidemiological triangle, meaning the pathogen, the host, and the environment. There is too much focus on the pathogen. You know, there is a new variant, should be worried about the variant. I don't think that's the issue. The variants are going to change all the time. Evolutionary, we expect the variants to be more contagious, more transmissible over time, but less virulent. That's what we expect from evolutionary point of view. Of course, we can be surprised, so we need very good epidemiological surveillance, including molecular surveillance, but I don't see a specific reason to be afraid of the new variant. We should prepare for variants to come.
Right, like you mentioned that we should prepare for more variants to come. I want to ask you what kind of protocols should be implemented to curtail the spread of such variants?
So I think that we already learned that we need to work together with the public, together with communities, together with municipalities to have local response, of course, national and global response, but to have good local response and good surveillance system. So when we see that, you know, in my hometown, Rehovot, or in Chennai, or in Shanghai, or in any city, when we see that we have a surge, we should tell the public, okay, now you should be more careful. Use masks. Stay at home. From your voluntary point of view, avoid crowding. Get vaccinated. We know some of the ways to prevent. We also know that your general health, meaning whether or not you smoke, whether or not you do physical activity, whether or not you are obese and you have background illness, also determine your risk of severe morbidity and mortality. We know about disparities. We know that the vulnerable population suffer most, and we should aid the vulnerable populations. So that's what we need in terms of response, to be prepared and to have local response that is proportional to the risk at the current level.
Right. Thank you so much, Professor, for joining us in WION this hour and sharing your insights on this. Thanks very much.
Thank you.